Bronchiolitis for medical students. Bronchiolitis is a lower respiratory tract infection that usually occurs during the winters in children under the age of 2. The most common cause is respiratory syncytial virus RSV, but many other viruses such as rhinovirus, influenza virus can be implicated. Patients typically develop nasal congestion, rhinorrhea, and cough, followed by the onset of lower respiratory signs, including wheezing and crackles. Symptoms usually peak between days 3 and 5 of the illness and are often associated with increased work of breathing, including accessory muscle use, which we could be see as retractions. There could be nasal flaring and grunting. The respiratory symptom may interfere with feeding, increasing the risk of dehydration. There may be low-grade fever also be present. Treatment for bronchiolitis is usually supportive care, such as restoring hydration and nasal suctioning. Hospitalization is required for patients in severe respiratory distress or those with apnea, hypoxia, or dehydration. And in dehydration, it could be reduced urine output, dry mucous membrane, and these findings typically warrant supplemental oxygen or the intravenous fluids. Inhaled bronchodilators are not routinely recommended because they do not reduce illness duration, admission rates, or the length of hospital stay. However, one dose may be trialed for potential short term symptomatic improvement in a child with severe respiratory distress. The pathophysiology goes something like this. It is viral induced inflammation of small distal airways, and there will be bronchiolar obstruction from the sloughed epithelial cells, leukocyte, and mucus. And so there will be a narrowing of the airway, and that's why we could hear the whizzing sound during the expiration. The radiological finding typically shows bilateral hyperinflation, increased interstitial markings, and peribronchial coughing. Talking about the complication of bronchiolitis include the following. In acute cases, infants which are age of less than 2 months and those born prematurely or with cardiopulmonary diseases are at greatest risk for apnea and respiratory failure during peak symptoms. In contrast, older, full term healthy infants and young toddlers typically recover with no acute complications. Talking about the long term complications following resolution of the symptoms, bronchiolitis caused by the respiratory syncytial virus that require hospitalization is associated with the development of recurrent wheezing in early childhood in up to 30% of the patients. Patients should be advised to limit avoidable triggers of airway reactivity, exposure to secondhand cigarette smoking when possible. That's one of the major cause. And this is all about the bronchiolitis. Thank you.